My name is Dr. Jodie Guest. I'm an infectious disease epidemiologist and professor and vice chair in the Department of Epidemiology at Rollins School of Public Health at Emory University. I lead Emory's COVID-19 outbreak response team working in harder hit communities across the state of Georgia to provide vaccinations and testing. And I am the host of Emory's COVID-19 Facebook Live events where we cover important topics about the COVID-19 pandemic. Today, I'm very pleased to be joined by Dr. Bryce Gartland. Dr. Gartland is Emory Hospital's Group President and Co-Chief of Clinical Operations for Emory Healthcare. In this role, he is accountable for overall performance and achievements at the 11 Emory Hospital healthcare settings and serves as a core member of Emory Healthcare's strategic team. He formerly served as CEO of Emory University Hospital, Emory Orthopedic and Spine Hospital, and Emory Wesley Woods Hospital. Dr. Gartland joined Emory as a physician in 2005, practicing in hospital medicine. He has played key roles in numerous accomplishments, including the hospital's stellar University Health System Consortium rankings for quality and safety achievements and the Magnet accreditation for nursing excellence. Welcome, Dr. Gartland, and thank you so much for joining me today.
Thanks for having me, Jodie.
Absolutely. We're going to be talking about the impact of the fourth COVID-19 wave on hospitals today. But first, here are the latest COVID-19 numbers as of last night, September 26th. The US is fast approaching 43 million cases of COVID-19. Since early July, the US has had a huge fourth wave associated with the Delta variant. Primarily among unvaccinated people, we have seen increased cases, deaths, and hospitalizations. We are averaging 121,000 new cases a day in the United States, and this is down 17% since this time last week. While 95% of counties in the US are areas of high transmission, new COVID-19 cases remain highest in several states. Cases have been climbing at a very, very fast rate in Alaska, with a 62% increase in cases in the past 2 weeks. The states with the next highest case rates are Wyoming, Montana, West Virginia, and Kentucky. And for the first time, the entire Southeast is not in that top set of numbers. 12 to 17-year-olds continue to have the highest case rate, followed by 18 to 39-year-olds and 5 to 11-year-olds. New hospitalizations are down across the United States this week by 16%, with more than 9,000 people being admitted each day in the United States for COVID-19. While down from last week, there are currently more than 80,000 people in the hospital with COVID-19. Sadly, we are still averaging more than 2,000 deaths a day in the United States from COVID-19, and Georgia has the highest death rate in the United States, including 901 deaths from COVID-19 in the past week. The US has vaccinated more than 213 million people with at least one dose of a COVID-19 vaccine. Currently, 56% of the US population is fully vaccinated. And given our topic today, it is important to point out that the 10 states with the lowest vaccination rates have COVID-19 related hospitalization rates that are 3 times higher than the 10 most vaccinated states, with Georgia being one of them, where 45% of the total population in our state has been fully vaccinated. So Dr. Gartland, let's begin by talking about what's happening inside Emory hospitals during this fourth wave of COVID-19. A month ago, Grady was on diversion and our hospitals were at more than 90% occupancy for ICU beds. As we reach the 18 months of the fourth surge of the COVID-19 pandemic, what are we seeing in Emory healthcare hospitals today?
Perfect. Thank you so much, Jodie. And again, thanks for allowing me to join here in dialogue on kind of COVID-19 and this fourth surge.
Absolutely.
So thankfully, at this point in time, we have started to see a decline with this fourth surge across really metro Atlanta healthcare systems. We actually got to about 92% of our January peak level, so pretty significant in terms of overall demand. And that's particularly true with a lot of the staffing challenges we had, and I know I'll talk a little bit about that later on. At this point, we have seen a decline over the past several weeks. We're now at about 57% of our peak that we experienced towards the latter part of August time period. That said, as we get later into the surge, we are experiencing a lot more demand for intensive care unit or critical care level demand, which is not unsurprising, as patients kind of go through their course of hospitalization, and those that unfortunately don't improve, we have a tendency to see them, kind of progress into critical care level side, which unfortunately is kind of an ominous sign of anticipating more deaths, over the ensuing days and weeks as patients' clinical course progresses.
So how does this surge feel different from past surges in the hospital?
Yeah. Well, with each surge, we've seen increases in regional variation, right? You talked about that earlier in terms of different parts of the United States being impacted differently. And unfortunately, with this fourth surge, that was largely correlated with differences in vaccine acceptance. And as we know in the South, in many of the states that you've listed out, we've actually been kind of under-vaccinated in comparison with other parts of the United States. And so, with this fourth wave, again, the South has been disproportionately impacted. This surge is, as you mentioned, kind of largely one of the unvaccinated, potentially could have been preventable or at least significantly mitigated. And that's represented by the patients in our hospitals, depending upon kind of a given system or locale, upwards of 90% or more of the hospitalizations are actually of those that are unvaccinated. The other thing that we're seeing with this surge, and again, you highlighted this earlier, is kind of the demographics, right? You think back to the first and the second waves, it was generally those that were over 65 and that we were really seeing with COVID impact and hospitalized. Now we're seeing, kind of that, 10 to 17-year-old, as well as kind of reaching up into that 30 to 50-year-old age bracket. And particularly as schools have returned, and it's not necessarily so much what happens in schools, but school-associated activities such as athletics or certain sporting activities, and or kids getting together outside of school that in turn, end up being kind of the vectors that help, transmit and bring it back to their families, impacting kind of that parent range of the 30 to 50-year-olds.
So what are some of the challenges currently being seen in the hospital setting? I know that this fourth wave has been overwhelming, particularly, as you said, here in the Southeast. So for our hospitals here at Emory, what are your biggest challenges?
Yeah, so, one of the biggest challenges really comes within staffing. We've seen a lot of workforce challenges that existed entering into the pandemic. Things like, roughly 25 to 30% of our nursing workforce was either currently or would be eligible for retirement within the next couple of years. There were certain provider shortages. You heard a lot pre-pandemic around nursing shortages and kind of the need for increased nursing staff to be able to support healthcare. Also generational differences that existed, people that were much more, I'll say, kind of transient workforce in nature as opposed to hey, I've worked for an organization for 10, 20, 30 years, et cetera. And so as we entered into the pandemic, it really accelerated a lot of those workforce challenges that were already beginning to develop. And so, that's with COVID demand, we saw an increase in retirement. We've seen a lot of staffing challenges, have had to bring in a lot of traveler labor support. And it's important for our community to remember that this doesn't simply impact access to COVID-related care. These staffing strains, as a result of kind of those COVID-induced kind of impacts, really has strained our national healthcare systems in terms of non-COVID-related care as well. It's important to remember that while people may talk about kind of elective healthcare, the vast majority of healthcare is really not elective. It may not be as time urgent, but in the end, all aspects of care are really important. The other one that we've seen continued are supply chain vulnerabilities, right? I think a lot of us have experienced those within our own lives as well, whether you're trying to get a new computer and can't get the computer chip for it, or trying to buy a car and it's very challenging these days. It's not as much kind of, I'll call it personal protective equipment. We have good supplies in that standpoint, but a lot of our other kind of routine medical supplies, we're seeing kind of similar supply chain challenges, not unlike other industries that can potentially impact the ability to, reliably have all those supplies to provide care to our patients.
I don't think that we've been talking enough about supply chain issues still having such a large impact. But one of the things that we do see people talking about off and on is compassion fatigue. And so how are the humans, the staff, the clinicians holding up throughout this latest surge in the hospital? Because I know they must be so tired.
Absolutely. This fourth surge has really taken a much larger toll than the first three on our staff. as you talked about, it's not just about the physical exhaustion, right, of the continuous hours of wearing PPE, taking extra shifts to help support one another. That kind of that empathy fatigue as well is really significant. And I think that's particularly true as we've gotten into this component of where it's, again, largely unvaccinated individuals are being hospitalized. That can be very frustrating, demoralizing for our healthcare providers. Like all healthcare systems, at Emory, we continue to do everything possible to really support our staff. That's both big and small in terms of items to really try to help, support one another. I think one of the other, real challenges that we've seen with this fourth wave is a significant increase in workplace violence. And that really further exacerbates the situation. We're not the only industry that's experiencing this, as many of you have probably read in the media around, similar workplace violence issues, whether they're physical or verbal on airlines or other industries. And it's really unfortunate, particularly here where we come from a very scientific background, right? We know that masks and vaccines work, and unfortunately, those have become very politicized, as well as unsupported, scientific therapies. And so it's a real challenge for our care team members to have to deal with that in addition to all of the physical exhaustion and just kind of empathy fatigue as well.
And I would imagine that sort of workplace violence and the partisanship that is associated with this is not something that everyone would have anticipated or expected. And it's not what you normally see when you work in a hospital.
Absolutely. Our care team members, they really want to do the best for every patient that comes to the door, regardless of an individual's political views or background. But, obviously when things get very heightened and confrontational, and listen, we get it. We understand that people are, frustrated, that people are ready for this pandemic to end. But in the end, our care team members are really trying to do the absolute best that they possibly can. And, we really want that partnership and support from, the care partners as well as our patients.
Absolutely. As we talk about the pandemic ending, and we all certainly want it to get there, there have been a lot of conversations about what this will look like. And beyond the Emory hospitals, the impact of this fourth wave, as you said, has been substantial on healthcare overall. Across the state of Georgia, we still have some of the, as I said before, the highest rates of COVID-19 hospitalizations. And several states have found themselves in the really terrible position of rationing care. Currently, we're seeing this in Alaska, in the Anchorage area, at Providence Hospital. So as the leader of the Emory hospital system, what would make our state get to this point? And really, truly, how bad does it have to get for hospitals and states to make this kind of a decision?
Absolutely. I think we've come as a state, we've come to brinks of that over, not just the last wave, but actually the first several as well, right? You think back in terms of, surge 1 and surge 2, where we were talking about ventilator availability and the like, with the fourth wave, you've probably read in some of the media around ECMO availability, right? There's more demand than there's actually capacity. Thankfully, we've, not had to get to the point of, kind of rationing care at Emory Healthcare. But it's also important to remember that, access to healthcare exists across really a continuum, right? And rationing represents kind of just that extreme to one end. And as our national and state of Georgia healthcare systems have been taxed, by demands of COVID, we have seen access impaired, right? So it's not rationing in terms of that, extremist component, but it is definitely within the triaging aspects, right? You've read about that in things like healthcare systems having to forego, again, I'll use the term elective, surgeries, et cetera. But, again, very little of healthcare is truly elective. And, those individuals whose care has had to be postponed, it does impact, their quality of life and well-being. And so it's important for us to recognize that, it's not just rationing, it's really across a continuum of components. And as our systems continue to get strained, and it's a very dynamic situation between demand and capacity, there is a reality of where if things get, significantly worse, you could end up in a position of truly rationing care as the context you were sharing.
And, a terrible position to be in for sure. Another concern from the very beginning of the pandemic, when most did not believe that we would still be doing this, for this long, was that the final two waves of the pandemic would be increased morbidity or deaths from those who had preventive care delayed. And then the last one would be a reduction in the healthcare workforce, both now and in the future. So what are your thoughts on these two waves still occurring as a result of the stress we are seeing on hospitals and our employees now?
I think, Jody, there's probably two questions embedded in there, right? Which is, in terms of specific COVID-related care, we've made significant advances in terms of both the therapeutics as well as the care protocols. And so, that combined with also the demographics of who's contracting COVID, we are seeing some improvements in outcomes, right? You think about things like monoclonal antibodies, again, care team protocols in terms of improved ventilation, the likes. We're seeing some improvement in some of the morbidity and mortality with regards to COVID specifically. I think the, kind of other question embedded in there is really, what about the impact of the non-COVID related care?
Right.
I think that from, my personal perspective, there's no doubt been significant impact on non-COVID related care. I think the reality of when we'll be able to assess that, though, is really over the years to come, right? You think about individuals that, did not necessarily receive cancer, screening or prevention over the past 18 months that all of a sudden are going to be diagnosed. And now they're going to be diagnosed at stage 3 and stage 4, not necessarily stage 1 and stage 2. And ultimately, that's going to have, some significant impact in terms of morbidity and mortality. So I think, no doubt there's been impact from my perspective, but really the full extent of it really is going to be assessed over the years and frankly, decades to come.
And do you think we'll see the same issue with a workforce concern for healthcare in the future? Some of this was already coming, and some of this may be about having worked through the time of COVID.
Yeah, I think, in terms of our workforce challenges, I think that is going to, again, be, years, if not decades in the rebuilding. You think about what really needs to occur now from a rebuilding of that workforce, particularly as, the service industries at large. And remember, healthcare is in large part a service industry. Like we like to think of ourselves as kind of more the technical side, but in the end, we're truly a service industry. We've seen a significant migration, away from the service industries towards either technology enabled or remote related, work type of options. And so, attracting individuals back into the service industry and rebuilding that workforce is going to take years or more to really come to fruition. I also know that it's a top priority, in terms of discussions within the state. There's a lot of opportunities of how we can have public-private partnerships to really help develop and accelerate the development of that workforce, which is necessary from just a healthcare system infrastructure standpoint.
That's great to hear. As you pointed out, a year ago, we only had public health interventions to stop the spread of COVID-19 and treat you if you got sick. Now we do have incredibly effective vaccines and monoclonal antibodies. So let's spend a moment talking about these two things. Emory Healthcare is requiring all physicians, clinicians, and staff to get vaccinated by October 1st. That is just 4 days away from today. Why do you feel this requirement is so important?
Yeah, great question, Jody. And, really for us, first and foremost, we care about the health and safety of our care team members. We want to do everything possible to support their well-being, both at work and at home. We strongly believe in the science behind the vaccines in terms of their safety, their efficacy, and therefore, really move forward with a vaccine requirement, with those in first and foremost. It's also important, to kind of as a, critical infrastructure component within our community, to maintain resiliency of our healthcare system, and if we have an increased number of healthcare workers that are even out sick temporarily, that has real impact on our ability to provide needed services to our community. So it was critical from our standpoint to build that resiliency through vaccination to make sure that we have continuous ability to really meet all needs of our community when it comes to healthcare.
Absolutely. And, and healthcare requirements for those who work in hospitals are not new. This is not something new to COVID-19. So let's spend just a moment on monoclonal antibodies. For those who qualify with mild to moderate COVID-19 disease, are you seeing that this is helping people stay out of the hospital?
Yeah, the short answer is yes, we are. As you've probably seen in some of the studies, there's about a 60 to 80% relative reduction in hospitalization rates. It is important though, when you hear kind of, oh my gosh, 60 to 70% reduction, kind of the overall rates are still relatively low, if you will, meaning that, you take somebody from a 3 to 5%, relative hospitalization rate down to about a 1%. So significant, but still small. We've seen that it is better with early treatment, but that also presents some of the logistical challenges, right? For somebody to be identified, they have to have onset of symptoms. They have to get their, PCR test for confirmation that indeed they have a COVID diagnosis, and then ultimately have to have access to timely monoclonal antibody treatment. We've gotten a lot better at that, but it still is just a operational challenge for just the logistic aspects. The other important thing here is to remember that availability of monoclonal antibodies should not be a substitute for getting vaccinated. Unfortunately, we see a lot of that of where somebody refuses vaccination, but in then turn, as soon as they get COVID, demands kind of monoclonal antibody treatment. And we really encourage everybody to get vaccinated, and so that they can really protect themselves from getting COVID at the outset.
I think that that's important to make sure that we know how we should be using monoclonal antibodies. Let's turn for a moment to our flu season. This is quickly approaching. Last year, we were lucky to see rates of flu at record lows, both in the United States and globally, even with really high levels of testing. So as a result, we had fewer flu illnesses, hospitalizations, and deaths compared to previous flu seasons. In fact, between October 1st, 2020 and January 30th, 2021, kind of the typical flu season, only 155 people in the United States were hospitalized with flu. That's a really remarkably low number. And it's a 98% decrease compared to the previous time period a year ago, where over 8,700 people were hospitalized with flu. And in terms of hospitalizations, laboratory confirmed influenza associated hospitalizations in the 2020-2021 season were the lowest recorded number since data began collected nationally for this in 2005. So as we think about this, it seems clear that early access to flu vaccinations, record levels of vaccination, as well as all the COVID-19 mitigation measures such as wearing your mask, socially distancing, washing your hands, staying home when you don't feel well, et cetera, really helped contribute to the decline in the flu season for 2020-2021. But it does not appear that a light flu season is predicted for this year. So as we approach our next flu season during the COVID-19 pandemic, where capacity is already tight, employees, as you are, really well described to us, are already incredibly stretched. How are the hospital teams at Emory preparing for this flu season, in addition to what's going on with COVID-19?
Yeah, Jodie, and well, number one is in my 2 decades of being in healthcare as a provider, I would have never thought that we would have batted a no-hitter in a flu season, which we did experience last year. In large part, represented by the fact that there was no global travel, right, was at a standstill, and many of the measures that people were taking to prevent COVID also have the added benefit of preventing influenza spread, right? Masking, socially distancing, washing hands, et cetera. And so, healthcare, as well as other workplaces, as we look ahead towards this season, are really stepping up their employee requirements. Not just in terms of COVID, vaccination or preparation, but also flu as well, which is a very good thing. Actually, I think this is one of the I'll say silver linings, if you will, of COVID, right? What are those lessons from COVID that we can carry into our other communicable diseases? Because flu every year has significant morbidity and mortality, as you talked about. From a healthcare system basis, we, like many, have really increased our community engagement to promote vaccination, including aspects like engaging school systems, right? How do you kind of get the message out throughout our community so that you get a lot more herd immunity effect? The other part that we've really taken on, given some of the staffing, challenges, is really also around care model innovations. Again, silver lining within COVID. How do we make sure that everybody's really practicing to their top of licensure? How do we shift our models of care, where we have kind of more right setting, right? Using urgent cares and or, telehealth, as opposed to individuals coming into emergency rooms, to, in essence, kind of have the ability to deliver, equal, if not better care, but also do it in a lighter touch, doing more with less from an overall resource standpoint.
We can only hope that this flu season is something like last year's.
Unfortunately, it's already in the community at this point. We've already seen some cases this year so far.
Yeah, so earlier flu vaccinations was one of the things we did last year, and certainly now is the time for everyone watching to get their flu shot. As we wrap up here, Dr. Gartland, what final message would you share with viewers to help support healthcare providers as they continue caring for patients sick from anything, with and without COVID-19, as our hospitals are perhaps starting to come a little bit down off this fourth surge, but are still so incredibly stretched?
Absolutely, Jodie. Thanks, and a great question. So, first of all, would really encourage everybody to be sure and thank our healthcare heroes. While much of America has really tried to move on from COVID, our frontline healthcare workers are really still in the battlefield of COVID. They're exhausted. They need your support and recognition now more than ever. And I think back to when you saw videos and heard pots and pans dinging at nurse shift changes and the like. We need that type of community engagement and support to really come forward and help support them now more than ever. And one of the best ways that everyone can help support is by getting vaccinated if you have not already been vaccinated. It also is a good reminder to go ahead and get your flu vaccine. You can actually get them concurrently if you'd like to, because we are, again, already starting to see an early entree of flu into our communities. And regardless of your COVID vaccination status, as long as prevalence remains high in our communities, we really are continuing to encourage everybody to, wear a mask indoors or outdoors when you're not able to socially distance, and, do the other good infection prevention measures around, washing your hands, good cough hygiene, et cetera. But that would all very much go far in terms of helping decrease the spread within our community, which in turn, decreases the demands from a COVID care basis on our healthcare systems.
All great advice. It is certainly important to recognize that our healthcare systems need our help, and that we will all benefit for when we need any sort of care, making sure that we are keeping all of our prevention measures front of mind. Please, if you've not yet been vaccinated, please find your way to a vaccine, including your flu vaccine this year. Wear your mask, as Dr. Gartland reminded us all. Dr. Gartland, thank you so much for being with me today to talk about what's been going on inside of Emory healthcare systems. And thank you for all you've been doing to help keep our community safe and your employees as safe as possible during these huge waves of COVID-19 that we've seen.
Thank you so much, Jodie.
Thank you. Have a good afternoon, everyone. Bye-bye.